Okay, welcome everyone. We're going to start the webinar. Welcome to today's webinar on reimagining global health research. This webinar is organized by Eva van der Linde and myself. My name is Marlies Visser, and with the support of our other members of the APH Global Health Junior Council. It is really great to see all of you who have joined us today for this conversation on reimagining global health research. Before we begin, I'd like to make some quick remarks on the format of today's session. You can also see it on the slides. As you can see, you've been muted upon entry. You will stay muted during the duration of the webinar. Please take this into account. We do, of course, welcome you to turn on your videos. We encourage this, but also please note that the webinar is being recorded. So in regards to the format, in the first 20 minutes, we will have a keynote by Dr. Seye Abimbola, who I'm incredibly happy to be able to introduce to you in a few minutes. And after that, Eva will introduce our other three guests and speakers to continue this conversation on reimagining global health research. And at the end of the webinar, we then have the time for questions from you, for questions from the audience. So if you have any questions during the webinar, please send them to me through a private chat. So send them to Marlies Visser, and I will be collecting these questions as we move through the webinar. And at the end, we will have the Q&A. We've also received some questions already from you, so thank you for this. We try to address these questions as much as possible throughout the webinar. And then if you have any technical questions or technical issues, please send a private chat to Jim Determeyer. So yes, a little bit about the background of this webinar. We are hosting this webinar as the APH Global Health Junior Council, and being early career researchers ourselves. And in the case of Eva and me, we're also mainly positioned here in the Netherlands. And we've talked quite a bit within our council about the importance of being continuously critical of our own roles, of our own positionality within our research. But also recognizing how colonial knowledge systems may have impacted the way that we actually, how we view ourselves, how we view the world, and what we ourselves consider to be knowledge in the first place. And we know this actually resonates with many of our colleagues, with many of our students. And this way, through this webinar, we really wanted to put this conversation higher on our agendas. And in our audience today, I know that we have a lot of students in global health, but also related fields. We have early career researchers like ourselves, as well as more experienced researchers. So we really hope this webinar can be a space for learning and reflection for all of us. And the aims of today are really to raise awareness and create a space to reflect on these current challenges that we see in global health research. But specifically the creation, the use and the application of knowledge, and then to discuss what implications this has for our research practice, but also for our role as global health researchers in promoting equity and justice really in global health. We do realize that this is a much bigger conversation that we can cover in 90 minutes. So we truly hope that this can be a starting point for ongoing conversations with your peers, your fellow students, but also your lecturers and with your colleagues. So yes, with that being said, we are incredibly happy and also honored to welcome our first guest and speaker of today, Dr. Seye Abimbola. Seye is currently joining us from Australia, and Seye is a health systems researcher from Nigeria. And in his teaching and research, he focuses on knowledge practices in global health, health system governance, and the adoption and scale up of health system innovations. He was awarded the Prince Claus Chair in Equity and Development at Utrecht University here in the Netherlands from 2020 to 2022. And this was for his work in justice in global health research. He is also the editor-in-chief of BMJ Global Health. So Seye, warm welcome to you. We're very happy that you could be here today. And with that being said, I want to give the word to you.
Thank you very much for having me, and thanks to everyone who has joined, and thanks to also the panelists with whom I will be joined in a discussion after my talk. Now, when you sort of said that the theme was reimagining global health research, it's, as you said, it's a very broad theme. So I decided to focus on something that I care very, very deeply about, which is the question of epistemic justice or injustice as a way of thinking about how we might begin to reimagine global health research. And what I plan to do, I was going to say this afternoon, this evening, but it's morning, your time. What I plan to do right now is give you 3 quick examples of that illustrate a lot of the things that bother me about global health research, which all of them speak to epistemic injustices in different forms. And then after that, I will have a quick sort of theorization then of those 3 stories that I will first share. So the first story, all of the 3 stories, I should say, have something to do with antenatal care. And you will see as I progress how seriously I take antenatal care. So the first story is about Senegal. For those of you who are familiar with global health research, you will know that there's something called the Demography and Health Service. And in 2018, there was an analysis of DHSs from, I think, about 50, 70 countries. And someone went in and did an analysis of a particular country. The DHS survey result of that country, Senegal, had suggested that men in Senegal aren't involved in women and children's health. And one of the measures to show that was that men didn't show up at antenatal care sessions. Only about 10%, 15% of them did. And of course, when you see that, the conclusion is that men are not involved. But what happens in Senegal, really, if you look more closely, and if you try to see Senegal through the eyes of people who live in Senegal, it's that the role of men is quite different. First, the assumption that takes you from 10% of men attend antenatal care sessions to men are not involved, assumptions that are deeply rooted in the worldview of those who designed the survey and who analyzed it and interpreted it. And those assumptions have a lot to do with the idea of how monogamy works, how the nuclear family works, how gender stereotypes work, but which don't necessarily apply in Senegal. And someone who did spend about a year or so doing ethnographic work in Senegal just showed that, the ways in which the roles are distributed, especially once a woman gets pregnant on behalf of a man, the man sort of goes into hyper gear, sort of into trying to raise money, trying to be responsible, trying to do all the things that men do. And there's a whole network of family members who look after the woman, who follow her to antenatal care sessions, who perform that role that the survey had assumed that a man ought to perform, with the assumptions of the nuclear family structure without the extended network of family. And in fact, one of the things that the author of the study found was that women deliberately discouraged men from following women to antenatal care session because they wanted that to be a sort of a space for women where women can have some autonomy, right? Again, something that completely someone who understands Senegal will understand, and by understanding it, give a completely different picture and interpretation and analysis of a data point or a study. Now, this, I will return to this later, is one of the many examples of the things that I see as an editor, but also encounter as an academic who reads papers. That often the way in which the survey tool was designed, the ways in which it was analyzed, the ways in which the data are interpreted, are filled with assumptions that just lead astray. So that's the first story. The second story, again, about antenatal care, this is about Nigeria. So I grew up with a midwife as a mother, and I hung around a lot of antenatal care sessions, most of which were group antenatal care sessions. In church, my mother was a very, very church person, and she would organize church women who were pregnant, and she would conduct group sessions for them. And also at work, after school, I would hang out around the hospital, and I would be on the edge of many of these sessions. Now, these sessions were my earliest exposure to healthcare, and to healthcare in a very non-traditional way. We were singing and praying and being educated in song often. You sing songs that educate you, and then it stays in your head. And then they share among themselves, they mentor one another. And it's such a, for me, the richest experience that you could have of a healthcare scenario. Now, I was going to do a paper about a year or two ago, and I realized that there had been 2 evidence syntheses on group antenatal care sessions. And one of them had said, with a lot of boldness, that it had been developed in the United States in the 2010s as a model of antenatal care. And that it was, in fact, important to assess the evidence base for such an intervention. Now, the second one, a review in 2018, said, given the success in high-income countries, we should take group antenatal care sessions to LMICs. But before we do that, we must check that it works in LMICs. And in fact, they did that. I don't want to mention their university, the citations of their papers are on this slide, but they went and did the study, including in Nigeria. And one of the most shocking things was that not once did any of this study, including the one done in Nigeria, mention that this is a long-established practice in Nigeria, first. Second, not once did they establish that Nigerians wanted to know whether group antenatal care sessions worked. Or in fact, not once did they mention what Nigerians really cared about in terms of evidence about how to make antenatal care sessions work. Again, that's the second story that I have, which again illustrates a lot of what I think needs to be reimagined, or the things that lead us to a place where we need to reimagine things in global health research. The third story is about something that I was actually involved in as a public health practitioner in Nigeria, but also again in many ways as an academic. So there's something called performance-based financing. Again, those of you who are familiar with global health might have heard of this. It's a World Bank thing. The World Bank loves it. When I say they love it, I mean that in a very bad way. They shouldn't love it, but they do love it. And it's one of the most widely implemented public sector initiatives in Africa. That's how successful it is, because, of course, the World Bank puts a lot of money behind it. And the idea basically is that if you want a health facility to improve its services, you provide incentives to the facility. And you provide incentives matched with the extent to which they can improve coverage of the services they provide and the quality of services. And a lot of the initial piloting of this initiative was done for antenatal care. And of course, it was first tried in Rwanda in 2001. The results were great. Of course, again, even though the results were against Rwanda, those results have never been replicated, and those results themselves have been challenged repeatedly. Now, the problem with this intervention, in my view, is not that it's a bad intervention. It is that it's a misnamed, misconceived intervention, right? In other words, this thing that's called performance-based financing, right? So there's an incentive component to it, which is that you provide this incentive to facilities to improve their services. But you can't provide incentive to facilities in a meaningful way without decentralizing the authority to use those incentives and to feel that there's a benefit from that incentive to the facility. In other words, you can only do this intervention in a meaningful way in a setting that is undergoing some governance reforms around decentralization, which was the case with Rwanda, which was the case in Burundi, where it was also tried and it worked a bit, although not in as grand a way as Rwanda. Also, what was going on in Zimbabwe, where it was well accepted. But in almost any other place, I mean, there was just this big set of questions. And it was in part because in the framing of the intervention, in the implementation, and in the evaluation of the intervention, it was never clearly delineated that there were two big things going on. the incentive was the simplest, smallest, most inconsequential bit of what was going on. The most important thing was deep reform. Now, deep reforms are difficult to think and talk about. Deep reforms are difficult to take from one place to another, pretending that you can implement the same thing in Burundi, Rwanda, Zimbabwe, Nigeria, etc., which of course they did and are still doing. And there's a lot to be said there for just how we simplify complex realities in global health. And that if we were to do global health as best a way as possible, we would have to grapple with the complexity of the entire thing. Now, I've often criticized performance-based financing, not because I don't like the intervention, but because to do it properly, you have to contend with the complexity of it and then start from that and not pretend as if things are simple and then conclude that things are complex. You could have known, you should know, we know that things are complex from the beginning. That's another problem that I have with global health research, that we tend to assume or want to assume and force things to be simple. And then we write a long paper and then we conclude that, of course, we found out things are complex. But that shouldn't be a revelation. It should be your starting point, right? So 3 stories of the different ways in which, I think about the problems with global health research. And a few things cut across these 3 examples. Of course, one of them is that our research, by its very nature, is prone to injustices. In other words, it's prone to these failures of respecting and regarding the knowledge held by other people and their interpretation of their own realities. And a good reason for that, the big reason for that, is that our efforts to reduce inequities, which is how I define global health, at any scale, whether individual or national or community, involves working at a distance. We are always working at a distance. And it's not just the physical, in a physical sense. I mean, there's physical distance often, but there's also very often a distance of power and income or race or culture or class or caste or faith, all sorts of distance we are working across in our efforts to reduce inequities. And when we are working across a distance, we are bound in many ways to get it wrong, which is why we must then prepare ourselves to not get it wrong. In other words, we can't assume, we can't just walk ahead as if we are not extremely likely to get it wrong, right? Now, often global health research involves the idea that something that works in a place or situation B should work in a place or situation A. So let's try it out or impose it in situation or place A. Or that the way of seeing the world in a place or situation B also applies to a place or situation A, which is the case with the Senegal story. In terms of intervention, is the case with performance-based financing, having worked in Rwanda. And these things are, they are, I was raised in a Christian home, and I often borrow lines from the Bible. And there's this line that from Paul, that there are sins that easily beset us. There are sins that easily attach themselves to us. And for me, the way I think about global health research is that these are basic fundamental sins that follow us everywhere, which then means, as Paul was trying to encourage Christians, I've since lost my faith, by the way, so I'm not speaking as someone who actually believes, but which still that means that you have to keep preparing yourself, re-exercising yourself so that you don't fall into these sins that characterize the very nature of the field of global health and global health research. Now, I've sort of alluded to the idea of epistemic injustice, and this draws from the work of a feminist philosopher, Miranda Fricker, who sort of defines epistemic injustice, and I've applied it and adapted it in the version on this slide. But essentially, as injustices done to people in their capacity as knowers, or as producers, users, or circulators of knowledge. She identified 2 types, which I will get to in a minute. But again, going back to the idea of working at a distance, it's often the case. I was describing sort of place or situation A and B, and that sort of things go from B to A. And it's often the case that people in place B or situation B tend to be in a position to decide which interventions or ideas are good or will work for people in place or situation A. And also people in place or situation A will tend to be in a better position compared to people in place or situation B to know what works for people in A. Again, basic construct. And I'm really trying to keep this very basic because this is the best way to leave things in people's heads. This is really very basic. But when you think about it, this is actually what animates a lot of what we do in global health research. It's this basic assumption. And it's our job to recognize them. Now, what Fricka said, and how she described those two forms of epistemic wrongs, one of them is the idea of credibility deficits, which she defines, which I would describe here as when A, people are not regarded as credible producers or audience of knowledge that is produced. Then, of course, that's an epistemic wrong because it's prejudicial. Or, in the case of interpretive marginalization, when the interpretations of A people is not what shapes the analysis or intervention that is done about them. Now, the result, and I think of the result, what results from this in two forms. In the first form, it's just really, really pragmatic sense. That when we don't incorporate the accounts of people, how people make sense of their reality or what they know, then our analyses are based on the wrong assumptions. Our results are wrong. Our interventions are wrong, misguided, as in the three examples that I gave. In the first example, the analysis was wrong. In the second example, the choice of intervention and recognition of what people knew or did not know or needed to know was wrong. In the third one, the intervention itself was wrong, often because, again, the nature of the intervention itself and what is needed in a place or space or situation isn't well thought through. But the second way to think about what the consequence of this is that we actually also, when we do these things, we fail to respect the dignity of A people as knowers. Now, this is a concept that I take very seriously because I believe very strongly that we all as human beings are entitled to dignity. And we're entitled to dignity because of certain morally important features that we have. One of those morally important features is that we are knowers. We know things. So for me to then assume or pretend as if you don't know things, to talk to you, relate with you as if you're not a knower, is in fact failing to respect your dignity as a human being. So there's a principal argument here, but there's also a very pragmatic one, which is that first, we are just not doing the right things. We're not going to get the results that we claim we seek. But second one is that we're actually being really disrespectful of the dignity of people. Two consequences. Now, in many ways, when I'm thinking about what we are trying to do in global health research, and I've talked about this earlier, that what we're trying to do is really reduce inequities. And for me, when I'm trying to theorize what it means to work, to generate knowledge with the aim of reducing inequities, the way I think about it is that we are trying to connect the system to more of itself. Right? And I promise you, you can apply that framing to almost any effort to reduce inequity anywhere. It is that very often inequities abound because there are failures of connection, whether deliberate sort of severance of connection or a failure to facilitate connection that might otherwise be facilitated. And you can think of this again at different scales. Who doesn't know what? Who should know what? Who should use knowledge for what? Who is ignoring what reality? Right? If you can connect, the better connection we have, the more a system actually gives you equity. And the more a system is able to learn from itself. So for me, I'm thinking about connection as, in fact, in many ways, a way of systems learning from themselves and about themselves to improve themselves over time. And so, again, going back to these ideas of epistemic injustice, what happens when we are epistemically unjust is that we are not allowing connections to happen. Is that we are very often, in fact, being extractive. We're just often going into a place, doing what we want and going, not so much thinking very much about what does that system need to learn from itself and about itself and to connect more within itself. Because often that is the key to the inequities that we are seeking to reduce. That is the key to reducing them. Now, again, people who know things know us, hold knowledge, they learn. And often when I'm thinking of how to reimagine global health research, I'm asking myself, or when I'm reading the manuscript, when I'm talking to people, when I'm doing my own work, I'm asking myself, how can I start from what AA people already know, and what they're already doing with knowledge, right? What are they learning, and how are they learning, and what are their real learning needs? In other words, my work really is to direct my knowledge production efforts to their learning and their connection needs, and not to mine. Again, if you go back to the things we're trying to move away from, which is that we're often directing those, our knowledge production efforts to our needs. That's why, for example, the people who wanted to do a trial on group antenatal care sessions did a trial on group antenatal care sessions in Nigeria. Nobody in Nigeria wanted that, but it would look good on the CV of those people. Some funder would like it. It simplifies whatever it is that's the problem with antenatal care in Nigeria. So we're going to have this new innovation. It's coming from the United States. We're going to take it to Africa, and they're going to take it. We're going to, trial it. There's a story there, but that story really ignores the fact that people in that space, whatever space, they are knowers and they are learners, and they have learning and knowledge needs, and they have connection needs. And the question is always, how do we fulfill that? How do we address that instead of us? Second, is that people, they interpret knowledge. Knowers interpret knowledge, they frame knowledge, they have their own framework in their minds of reality. And again, it goes for me back to the Senegal example, that someone who understands Senegal will not have that analysis of Senegal, of men's involvement in women's health, because it means something else in that space, because in that space, there's a different way of being in the world. Now, again, very often in the work that we do, we assume a way that we think because we are B people, in other words, people who have power and believe that our worldview is universal or superior, if not universal, and ought to be spread across the world. We overlay our ways of seeing the world onto how other people see the world, and we get the wrong outcomes when we do that. So just again, being alive to how a system functions and how it adapts and interacts and connects and learns. And very often we would need to defer to how people in that space or in that situation understand their own reality. Sometimes we don't have to defer completely, we just have to combine ours with theirs. But in many instances, we just have to completely change, just as the Senegal example suggests. And this is my last slide, and I thought I'll conclude on something we're very familiar with, those of us who do global health research, especially those of us who are public health people, who sort of write papers in the IMRAD format. And one of the most interesting things about the IMRAD format, again, I say this as an editor, is that it's fictional, of course. It's a way of telling a story, and that's not the sequence in which things happen. And it's a very curated version of whatever it is we do in the research that we do. And I wish that we would allow ourselves, at least in global health, to revisit that structure, at least what goes into each part of it, as a way of beginning to ask ourselves, as I was describing earlier, where do I start? Right? We are used, for example, we are used to doing something in the introduction section of our papers, which is to establish a gap in the literature. And I just feel very often that is in itself epistemically unjust. That if our job is to connect a place to of itself, to begin from what people in that space already know, and what their learning needs are, perhaps what ought to take the giant share of our introduction section is actually, what people in that space already know. What do they want to know, right? And am I the person well positioned to help them know it? That could be, in fact, the starting point of a lot of the work we do in global health research. Second point to make here is in terms of what goes into the methods section. Again, people in that space have a way of framing reality. Again, going back to the Senegal example, if the people analyzing that survey's data were using the framework of people in Senegal to analyze it, they would have a different set of results, right? Again, trying to make sure that our data analysis do not rely on are very poorly informed, very often distant, often imposed set of assumptions about how a situation or a place functions. And our results section could begin to also have, pay a lot of attention to the new knowledge we generate, how it's optimized for addressing the learning needs at hand in the space, and also what we learned in the process. One of the things we don't do in the way in which we tell the stories, we don't put ourselves into the story as people who are learning things too. And it allows us to pretend as if we know things we have no business pretending we know. And in the discussion section, I often wish that it's a party description of how the results or the new knowledge that addresses the learning needs of a space was actually fed back into learning and action in that space. And more broadly, I wish that we get to a place where serving to connect different spaces more to themselves will be the measure of the work that we do. Because I think until we begin to imagine ourselves in that way and imagine our role as researchers in that way, we are likely contributing to epistemic injustices rather than contributing to reducing inequities. Thank you very much.
Thank you very much, Seye, for this insightful talk about, well, wrong assumptions, wrong analysis, wrong interventions that are caused by epistemic injustice, and the conclusion that, well, many people draw that it's complex, whereas that should be a starting point. So I really hope that we can continue from that starting point to agree that things are complex, but that we need to find new ways to connect and learn from knowers. So before we move on to the roundtable discussion, I hope that the audience can send their questions to Marlies, either to Seye or to any other of our speakers that I now would like to introduce. So the roundtable discussion will be in two parts, basically. So the first part will be more on ways of knowing and knowledge production, or other terms that we will be using for that. And the second part will be more on how we can implement decolonial practices before we move on to more a roundtable discussion on the key priorities in global health. So that being said, I would like to introduce our panelists of today. To start with Ike Anya. Dr. Ike Anya is currently a locum consultant in public health medicine at Public Health Scotland, and he holds teaching positions in public health at the Imperial College London, University of Bristol, and the London School of Tropical Medicine and Hygiene. He has worked in leadership positions in public, voluntary, and private sector in Nigeria and the UK. Today, we hope to learn from Ike's expertise in public health leadership and experiences as a consultant on how to implement decolonial research practices in global health. Thank you for being here today with us.
Thank you very much, Eva.
Dr. Zuleika Sheik is a lecturer in gender and post-colonial studies at Utrecht University. Her areas of focus include decolonizing methodology, gender studies, decolonial feminism, Black studies, transformative justice, and abolition studies. Through her PhD research, she has developed liminography, I hope I pronounced it correctly, an approach to research that is at once a decolonial feminist critique of the colonial knowledge system and reclaiming of knowledge and research practice as life-affirming. We hope to learn from Zuleika's expertise in gender and post-colonial studies and expertise and views on decolonizing methodology specifically. So also thank you for joining us today.
Thanks for having me.
Dr. Esther Miedema is a lecturer in the Governance and Inclusive Development Research Program at the University of Amsterdam. Driven by concerns regarding socio-ecological and epistemic justice and ideas of radical collective care, Esther seeks to contribute to the building of connections between people, disciplines, spheres of work, spaces, places, humans and non-humans. We hope to learn from Esther's thoughts on alternative ways of knowing and knowledge extraction. Thank you for taking part in this webinar today as well.
Thanks for having me.
So before we start the open discussion, I would like to ask a few questions to each of you, including to Seye. And of course, if you want to add, you're welcome to chip in. So I would like to start with Zuleika to ask you something on alternative ways of knowing in research. So in your work, you refuse the concept of knowledge production and propose knowledge cultivation as an alternative approach to research. Could you explain what the refusal of knowledge production means and how knowledge cultivation differs from production? And why is it important to make this distinction in research?
Thank you. Welcome, everyone. I'm really happy to see that there seems to be like a classroom full of people in one of the little boxes. So yeah, welcome. And it's also been a while since I've done one of these online things. I've been teaching in person a lot. So I kind of got used to that again. And this is sort of bringing flashbacks of lockdown. I also just want to quickly say that I've just recovered from COVID. I've had it for the first time, surprisingly. So my voice, I might have to take a break at some point as well. All right, so where do we start? Firstly, I think I'd like to start with a poem. And it goes like this. In a forest that has been logged for 500 years, the last tree standing was given pencil and paper and told to tell their story. This, for me, is the entry point of the ways in which we speak about knowledge production in academia. And I think where I want to start is with questioning methodology itself. So usually as graduate students and as early career academics, we're often sort of encouraged to go for this low-hanging fruit, as Tuck and Yang sort of put it in their article, Refusing Research, right? We go to the communities that we know, we go to the people that we know, especially as researchers that are maybe first generation, people of color, people from the global South. And we're told not to question research and methodology at the ontological and epistemological level, right? Pick a case study, pick a problem from the global South, go and find possible solutions, right? And so in my PhD research, I started actually with starting to question methodology itself, because what I couldn't find was a method that would account for a positionality that was not one that was the Western modern colonial subject. And I went through a lot of methodology books, visual methodologies, creative methodologies, photo voice, participatory filmmaking. So with all of these, I always just came back to the same problem, that it's not accounting for a non-Western sense of self or understanding of self. And then I came upon the work of Linda Tahiwa Smith, Decolonizing Methodologies, and the South African anthropologist Nokuthula Shlabangane, who basically both of them are saying that these methods are imbued with the logics and the codes of colonization and imperialism. And by using them, we're reproducing. But also then at the same time, I'd been reading Audre Lorde's work, and this line always stuck with me: the master's tools will never dismantle the master's house. And it continues on to say that it may bring about small amounts of, it may allow us to temporarily beat him at his own game, but it will never bring about genuine change. Sorry, it's also probably COVID brain fog that I can't remember the quote. So these are all the things that I started to see that were problematic about knowledge production. And then we bring in the element of its relation to the ways in which it's extracted from indigenous peoples. We think of fields of anthropology, for example. And here, Linda Tuhiwa-Smith's book opens up with the line, in the Indigenous world, research remains the dirtiest word in the Indigenous world's vocabulary. Where do you go from there, right? And so, then we sort of link knowledge production to producing and to the academic capitalism that we're all a part of, that we're complicit in. And we know that the neoliberal policies have infiltrated the university at multiple levels, not just in terms of journal articles and producing knowledge for this sort of neoliberal machine, but also the ways in which our intellectual work is sort of used to justify or to reinforce the inequalities that are already there. So this is where refusal comes in. And this comes from Tuck and Yang. They are Canadian researchers. One is Indigenous, the other is settler Canadian. And they write about not just neoliberal academia, but also how when we are told to tell our stories, the only stories we're allowed to tell, and this is from a Global South perspective, is one of pain and humiliation, the suffering of our communities, how things are so dire and terrible, and we have all of these problems that we can't get away from because actually we're the problem, right? And again, we're enforcing this Western perspective again. And so what happens if you refuse? What if you refuse to use these tools? What if you refuse to be, we can't completely be independent within the academic system. We all have complicity, right? But how can we minimize that complicity as much as possible? How can we use the resources and the spaces to bring about justice in small ways, even? I'm going on for too long. I have the last bit about cultivation. Shall I say it?
Yeah. And then I would like to ask Esther maybe to reflect on this, but first go ahead, Zuleika.
So we've covered refusal, we've covered, sorry, my teacher hat is also coming on.
Going very fluid.
We've covered refusal, we've covered production, and then we go on to cultivation. So in sort of choosing not to even use the word knowledge production anymore, we open up space, right? And in opening up that space, I use the work of Robbie Shilliam. He's the one who coined the term knowledge cultivation, it's not mine. And in that sense, with knowledge cultivation, we're firstly delinking from this knowledge production. So I have to look at my notes as well. We're delinking from this modern colonial knowledge system. That's the first step, so the critique, right? But then the second step is then changing the terms of the conversation. How do we not extract data from people? How do we not use people as data? How do we not extract from them? We know that we're gaining degrees, we're gaining journal articles, we're moving up the academic ladder. But what is actually happening to the communities and the places in which we choose to involve in our research? Because we're choosing to involve these people. We are already intruding into their lives. And so one level of cultivation is starting this process of unlearning, of moving from results and solutions and outcomes to lessons and practicing, that we practice research. We'll get it wrong. We'll make mistakes. We'll keep getting it wrong. But it's the lessons that come from those mistakes that are valuable, not the actual outputs that we are giving to funders or the university or that sort of thing. And importantly, then, cultivation is about having epistemic vulnerability. And this I take from the work of Gerry Sneeman, who's a South African theologian. And epistemic vulnerability is something that we can all practice. And it basically has to do with having the ability to be changed by another story. So imagining that within the research process, as much as you expect there to be changes or effects within the communities you work with, so will those changes be reflected in yourself. And that's what Shilliam is sort of saying when he says that there needs to be habitation in the communal, a return to the communal. And last point is that cultivation is based on the principles of reciprocity. It's always give and take. It's not just take, take, take. On relationality. So here, how do you come into relation with yourself, with others, and with the land? About building coalition across differences. So colonial logics will collapse differences. It will move towards assimilation, whereas knowledge cultivation is moving towards being creative without differences and seeing them as pluses. And lastly, about accountability. In refusing, who then are you accountable to? Are you accountable to the ethics form that you filled in? Are you accountable to the funder, to your university? Or are you accountable to the people you've chosen to involve in this process? I'm going to leave it there.
Thank you very much, Zuleika, for this overview. I would like to, it's a lot that we need to reflect on. And I therefore would like to move to Esther, because if I understand correctly, you have some experience with, or you're working on projects more on knowledge extraction and research. And how have you sought to address this in collaboration with your international team? So yeah, what are some of your experience? Would you be happy to share?
Thank you. And thank you, Zuleika, for that. It was great to hear you talk about the cultivation and to put names to things that we're also trying to do, but perhaps hadn't named quite as such. So that was clarifying. So thanks for that. I have an angry cat at the window, so might be disturbing our conversation. Yeah, there's a few things I'd really like to sort of try to link up with. You mentioned words of, well, reimagination is something that is a sort of central theme of today, but also processes of unlearning, which is very much central to what we're trying to do. And you introduced it as extractivism of knowledge, but the project that Eva's referring to is sort of this new collaboration, and one or more of my colleagues might be present here today. But the collaboration is alternatives to extractivism and exploring ways of being, doing, and knowing in relation to the subsoil, with a focus in Mozambique. And one of the things perhaps which is a tension in what we're trying to do, is that, which is very much reflected for me in the title. So there's alternatives to extractivism, whereby you're looking for alternatives to extractivism, in this case, particularly to what's in the soil. But in the title, you're centering extractivism, whilst you're trying actually to decenter extractivism. So that's a difficulty that we're having, that we're focused on extractivism, but actually we want to move away from extractivism. We're hoping that the second part of what we're doing, the second part of that title, also shows how we're trying to, some of the ways in which we're trying to move away from it is looking at ways of being, knowing, and doing in relation to the subsoil. What are different ways of relating to soil, to non-humans, to the world around us? And also very explicitly playing with the words that we don't order it as knowing, being, and doing, where knowing always comes first, but that the being or the doing comes first, and to not center again the knowing necessarily as something, we know, therefore we are. So we're very much trying to sort of decenter knowing as the principal thing that we're focusing on, focusing being and doings, and in that way we'll try and explore the ways of non-extractive research and non-extractive relations to the subsoil. The opening up of space that Zuleika was referring to. How do you open up that space? And I think I'm preempting another question that maybe will come later, but how do you open up space when you've been trained, formally educated in thinking and occupying spaces in very particular ways? So how do you do that differently is something that we're all grappling with. And for me, there, the beauty of working in a team really comes to the fore, is that if there is a space there for the epistemic vulnerability that Zuleika referred to, then you can call each other to, you can call one another out, and you can point to one another's blind spots. So actually, since my PhD, I've not worked individually, and I'm going to keep it that way. The teamwork is very powerful in this particular collaboration, and we're at the beginning, sort of early stages. So I hope it's not just the honeymoon, but we're really trying to figure things out as a team, and also in the research that we're doing. We've worked with sort of with very different, with the initial exploratory research we're doing was very mixed team of people, and each asked different questions, and then you come together as a group and you have a very diverse set of questions and engagements with people around you. So the teamwork for me is a real is very important point. Perhaps just to add one final thing, and that I'm teaching again tomorrow, and we're going to be talking about this, is in terms of extractivism and data extraction, and who gets acknowledged in academia. I'm working with the work of Moya Bailey and Trudy, who talk about misogynoir, where they talk about the anti-Black racist misogyny that particularly women of color, Black women, suffer from. And I'm going to try and quote from their article. They say that Black women's ideas or artwork is mocked first, plagiarized second, and absorbed into the mainstream last. So that for me, also thinking about extraction and data extractions is to use very much an intersectional lens and a concept like misogynoir to see, well, who particularly is affected by these kinds of extractions. And this is particularly about an academic space, but I think it applies more broadly. I can ramble on for a long time. I think I'll stop there. Thank you.
Thank you. Thank you for sharing your views on, again, this complex concept. But I think it's good, at least, that for some it might be the first time they hear these terms. So it's really good to hear your reflections. I would like now to try to move from more the concepts to the practical aspects, because well, many of us are working in global health research, so and many of us are young researchers. So Ike, I would like to ask you, you have lots of experience as a leader in public health. So given this expertise, could you give us advice on how we as early career researchers can become leaders in the efforts to reimagine global health?
Thank you very much. And thank you, Zuleika, Esther, and Seye. You've said many of the things I was going to say. It's refreshing to see all this being talked about and thought about and spoken about, especially as I'm not an academic in that sense. I dabble, I like to say. I think, I've just written down a few points, or if you like, exhortations that I think you should apply, or anyone should apply. And it's not just to this sort of research. And the first is, ask yourself, why am I doing this? It's something I ask the students. I teach an ethics session for diploma in tropical nursing students at London School of Hygiene. And I start with asking them, why are you doing this course? And ask yourself that in a genuine and true and honest way, acknowledging the often unspoken motivations. So, do you want to go and save Black and brown babies or Black and brown women? Do you like the idea of moving around in 4x4s, and being seen as this hero? There's an element of that in all of us, and acknowledging it, I think, is a starting point, and not just the narrative of, I'm a noble person who wants to do good. So that's, I think, is a starting point. And then the next is vulnerability that Zuleika talked about. As I grow older, I turned 50 a couple of years ago, and I become more appreciative of people who are able to show vulnerability, because I think it's a very important attribute, and I have less and less time for people who say with confidence, everyone knows that this, or everyone does things this way. Because my immediate reaction is, everyone where? You know, in your family, in your experience. And that's a gift I received from doing social science as part of my master's at the London School of Hygiene, where I was, you know, I came to the realization that a lot of what I knew was based on, you know, my background as a son of an academic, a Nigerian academic who had spent time in Britain and Nigeria, you know, a Christian family, all sorts of influences that I didn't necessarily acknowledge. And I think it's important that we interrogate some of those. So instead of saying everyone knows, say, in my experience, this is how this works. How is it in yours? Then I'd like us to be conscious of the parallels. So, you know, I remember during the Ebola outbreak in West Africa, I went to a conference. I was based in the UK, but doing work in Nigeria. And I went to an American university for a conference. And I was asked to speak to the global health class about what some of the things we were doing around Ebola. And after I'd spoken, one of the young women in class said, but if these funeral practices are at the core of the transmission, why don't they just change their funeral practices? And I said to her, as Deputy Director of Public Health for Kensington and Chelsea in London at the time, I would sometimes look at our data on coronary heart disease and cancer and look at our smoking rates and think to myself, why don't they just stop smoking? And the reality is that if we knew how to change human behavior like that, you know, I said to the young woman, you and I would become billionaires because it's something no one has been able to figure out. But, you know, I say that lightly, but I hope you get the essence, which is to be conscious of the parallels. Again, another example is, you know, when modern Nigerian women were refusing the polio vaccine because there were rumors that it had anti-fertility drugs in it. And, you know, it was framed even in journals as this sort of, you know, illiterate, lack of knowledge, something that needed to. But then, you know, at the same time, around the same time in the UK, we were facing the MMR and autism, you know, where upper middle class parents were refusing, you know, again, so I often think of starting a class or a session on what I call comparative global health, where you take, you know, incidents that happen in two different places. Another was during Ebola when the Sierra Leonean president locked down Freetown. And you had all these professors saying, oh, of course, there's no evidence that this will have any impact whatsoever. And, you know, and then not weeks later, David Cameron ordered screening of people at airports, which had no evidence either. But, you know, the framing among academics was, well, you know, he has to demonstrate to the people that he's doing something. Well, what do you think the Sierra Leonean president was trying to do as well? You know, so it's those sort of things. So again, I think a point I'd like to make, accord every human equal dignity. Seye touched on it, but I think it is absolutely important. We say we do it, we don't actually do it. And I hold up my hand. And I, in some ways, over lockdown and all of that, I've been reflecting on population health and public health and thinking about the ways in which we have failed. And I think it's great that we look at populations and it helps to, you know, make problems manageable, if you like. But what we often lose sight of is that behind those huge numbers are human beings, individuals. And so instead of trumpeting that we've raised the immunization rate from 50 to 89, we should be saying, isn't it a shame that 11,000 children in this town still are not immunized? You know, and the whole idea that, you know, you provide certain standard of clinics or certain standard of schools that you would not send your own children to, that you would not, clinics that you would not go to yourself. You know, why do we, if we accord people equal dignity, why do we think that's acceptable? And I know, there are lots of arguments about resources and all that, but I think the starting point is acknowledging that. And that's something I'd like you to think about. Be creative. I think Zuleika talked about this and Esther as well is doing it. And share, be creative, don't just take the orthodoxy and accept it. Question it. The critical appraisal you're being taught, apply it to critical appraisal itself. And then, look for creative ways of doing it. And then I often say in relation to racial injustice and equity, that if you really care about it, every human being, whenever you are in a room, in an event, in a meeting, ask yourself who isn't here. Because I look at my alma mater, the London School of Hygiene and Tropical Medicine, and I ask myself, how could my professors sit doing tropical medicine and not notice that there were no Black or brown professors or academics around them? So please ask yourself who isn't here, and ask whose voice, whose knowledge, whose ways of knowing are not being recognized, and seek to bring them in. And my final point is, please do not be performative in demonstrating these practices. So, don't say, because sometimes when I teach my session at the London School of Hygiene, at the end, I get some of the young nurses coming to me and saying, oh, now, I don't think I should, I have finished the course. I don't think I should even go at all because, you've made me see that. And I said, no, that's not the point of my session. Help is needed. Hands are needed, even if it's just to, dress wounds. I don't think there's any country that has sufficient nursing resource. However, don't, as a nursing student, year 3 or a junior nurse, go in London, go to, my hometown, Abreba in Nigeria, and suddenly start acting like a matron. It's a very senior nurse. That's the whole point. And so that's what, and so, sometimes what happens is then people say, oh, I'm just a Western PhD student who knows nothing. Please tell me what, and that is actually, it's false because, you have the privilege, you have that position, and so sort of going to that extreme isn't the answer either. What we want is a partnership of equals as far as possible, in spite of the way the world has made us unequal. Thank you very much.
Thank you, Ike, for sharing questions that we should ask ourselves when engaging in global health. And for the final 5 minutes before we move to the Q&A, I would like to open the floor really to discuss. I think many important points have already been touched upon, but maybe we can discuss briefly what should be the priorities. And then I think, of course, we need to learn, we need to have different voices heard, we need to connect, like Seye already mentioned. But what are your reflections on this? And this is to all of you.
Shall I go first? I think in terms of, what our priorities, so maybe I need to explicitly say that I'm not a global health scholar. My entry point to most of the discussion is through development studies, which is technically what I did my PhD in, like it's on my degree, but it was basically a sort of smashing of development studies. And I think, our starting points are the priorities that we need to, in order to think about priorities, we first need to think about starting points and where are we starting to tell the stories that we tell. So when I listen to Seye's presentation, when I listen to Ike's presentation, I sort of think about how the knowledges that those people and those communities already hold is not seen as valuable. Particularly if we think about global health, its emphasis on medicine, on the body, the medicalization of the body, and how in many non-Western knowledge systems or non-Western ways of knowing and being, the body is not seen as separate from the land. And so when our bodies are sick and the land is sick, and we think about extraction, we start to see how these things are connected. And so we need to be explicit about the colonial origins, especially also of some of the medical interventions that we want to diffuse into global South countries, right? The hesitancy of people to get vaccinated, the hesitancy of infertility, for example, has a long colonial history of forced sterilization. Puerto Rico, for example, is a important example. So one is sort of acknowledging this, you know, especially when we talk about ethics. And here I often use the example of the Tuskegee study that was done in the US, where African-American men were purposefully injected with syphilis and then given placebos, right? So this hesitancy and suspicion doesn't come from nowhere. And the only way that we can start to undo these things and prioritize global health is to start to have these very difficult and uncomfortable conversations. And lastly, I think what I want to say is that it does start with decolonizing the self. You need to already acknowledge the ways in which you've been complicit, because the fact that you've made it here to graduate level already means that you've been through a system and you've been relatively successful in that system. And there's a reason you've been successful. And that's me included, right? I'm not saying I'm the exception or something, right? And it's then how do we deal, firstly, with the disconnection that's caused, disconnection to our own communities, disconnection to land, because we've almost been downloaded with a different hard drive. And then dealing with the insecurities that arise. So when we talk about things like race relations, legacies of slavery, of colonization, discomfort arises. And then we have these reactions of, oh, I should deregister from this course, or, you know, this is not for me. But it's important to go through that discomfort. All of us have had to go through that discomfort. And lastly, then it's about dealing with the shame. Okay, I've benefited from this. I've benefited from the system, but how can I stop and refuse and start to do better? Right? And often with, I teach a lot in Utrecht, most of my students are white European students. And how do I teach them to do this work, right? Because it's not just the work that needs to be done by people of color and people who are from marginalized backgrounds. Equally, the work needs to be done on the other side of the colonial divide. So we have work to do. The work is just different. So we can meet each other on common ground. Yeah.
Thank you very much. Does anyone of you want to have a final reflection on this, or shall we move to
If I can just jump in very quickly, I just wanted to,
yes, please.
on something Zuleika said there about responsibility. There's often, I've experienced a lot of pushback by people. I mean, like Ike was describing, like Zuleika was describing, of white students or students from a place of privilege, sort of being uncomfortable, and not just students, but also even senior people, even people whom you would expect to know better than to come to me with complaints about what I've said. But people are really deeply pushing back, and I understand that. But often what I say to them is that, well, I'm not asking you to be guilty. Your guilt does nothing for me or for the world. I'm asking you to feel a sense of responsibility. Not that you are responsible for whatever happened, but that you can be responsible for righting whatever it is that is wrong about the world. And that's the line I often do, and I deeply believe it. And I hold that dear as well as a person, that there are privileges I have that I feel I then have a sense of responsibility to making sure that it doesn't continue, or that it's widely shared. And in the space of global health research, a few things come to mind. One of them, and it's an example that I often make, is that there's nothing normal about me doing a study in Nigeria and wanting to publish it in London. It's not normal. It's normal when you so in the current academic landscape. It's normal because it's a given. But if you ask yourself, if you stop yourself for a second and ask yourself, but why do I want to impress the editor of the Lancet in London? Or why do I want to publish it in Boston? I mean, it strikes you that you want to do that because you were colonized. Now, it's really strange. And I've again had this experience just describing it to people in a room that the only reason why you want to go to Zambia to do a study is to you want to impress an editor. And the example of the group antenatal care sessions I was describing was just to impress someone who had nothing to do with wherever that work was being done. And for me, it's just reminding people again and again that this is not normal. These things are not normal. And if we can all agree that they're not normal, then it puts us in a different place to start to then collectively imagine what else we should be doing instead of that. And I often feel that the reason why things are not changing is because we don't have this shared conviction that these things are not normal. Because once we do have a shared conviction that they're not normal, we won't want to do it. We will feel so bad doing it that we will push to change it. So we follow through with the status quo because, in my view, too few of us believe it is deeply, deeply messed up.
I'd like to add two things, please. One is, I once had an African woman who spoke very forcefully in front of an audience of very powerful white people about why Africans needed to be in the driving seat of development efforts. And when I went to say to her, I appreciated her speaking so frankly. She said, this is how I always speak, even if it makes people uncomfortable. She said, my brother, we've been uncomfortable for a long time. Let the discomfort be shared. And I thought that was a great thing. So, we all live with discomfort because it's not as if the past, before these things were aired, everybody was happy. Some people may have been, but others weren't. And that was my first point. And my second point was to just also say what Seye has mentioned, which is, you've got to do something about it. It's not enough to just, acknowledge it. Thank you.
I believe Esther wants to add something. Yeah, and then we move to the Q&A. Please go ahead.
I'll be super brief, but I'm just in everything that is being said by Seye, Zuleika, I'm just reminded of Ruha Benjamin's work and a new book that she published on viral justice. And she's my new academic crush, so just humor me. But she says we don't need allies, but we need other people we need people who also smell the smoke. Allies suggesting that you're here to help me, which again reproduces everything that we're trying not to do, but we need people who also smell this. We all need to smell the smoke. And so I'm just reminded of that statement, which has really stuck with me. Thank you.
Thank you, Esther, for this metaphor. Then I would like to give the floor to Marlies, who has hopefully received some questions.
Yes, so I will be speaking on the behalf of our audience and the questions that they sent me through the chat. So I have one question. So I'll open the floor to all of you. So whoever wants to respond, please do so. So the first question that I received is, what role do you see for changing our knowledge production practices? So that being co-researching or transdisciplinary scholarship in the process of substantively decolonizing global health?
I'll just be very brief. Something Zuleika said, which I think is very important, is that a lot of what we might even do now, that we might want to wish were decolonial, are not really quite. you know, translate all of the terms. I don't want to repeat them so that people don't feel attacked. But all of the terms, all of these things are still really just the most baby of steps towards a decolonial place. I mean, we've not even really started properly. So in my view, it's important to take those baby steps, but to recognize that they are baby steps. You know, if I'm doing anthropology and I want to sort of do it better, it is still anthropology I'm doing. Right? I'm still constructing a certain way of seeing the world. I'm still trying to impress some vaguely defined entity somewhere in the West. I'm still within a certain tradition. So we can take steps within that tradition, right? But we must recognize that the journey is long. And it's going to take some time. It's going to take a lot of change. And for me, I never want to say that the baby steps are not important. I think they are very, very important. It's important to start, to do something. And I believe that the more we do, the more people we get involved in the doing, the more faster we can move toward that decolonial place.
Thank you.
Could I add a bit and maybe
yes.
push this discussion a little bit more? Because one of the things that, you know, let's say I started my PhD in 2014. The ideas that I was talking about were not, they were seen as really radical at that point. Nobody was talking about decolonial or epistemology or local knowledges versus dominant knowledges. And I went through 3 sets of supervisors because people didn't want me to ask the kind of questions I was asking. It took me 7 years to do my PhD. My process of unlearning took 2 years, but for 2 years, I didn't speak in academia at all because I was too scared of saying the wrong thing or being attacked in public, right? Academia is not a safe space, especially for people doing this kind of work, for women of color, for Black women, for people who are first-time university goers, working class, white working class. There's a certain type of person that can thrive in this environment, and it's not the majority of us. And so I think also to the students that are doing master's degrees or PhD degrees, be very careful. Refusal, abolition, decolonizing. If your supervisor isn't talking about these things or writing about these things, I would really caution you about doing, you know, there are things you can do already with anthropology, with ethnography, with the things that are already there. You mark, the decolonizing move you can make is to mark its limitations. What it can do, what those methods can do, and what they cannot do. And what they cannot do is bring about liberation and the collective liberation needed for all of us to be free. And so, you know, I want to maybe say it's great that now in 2022, decolonizing is everywhere and people are wanting to do this kind of work. But I have to, you know, I have to also be responsible in the way that I share these ideas, especially with young scholars, in that, and I don't like the word strategic, but you need to know the environment in which you're swimming in. And it comes again to this idea of this performativity and performing these things, right? To do meaningful decolonizing work is to question these systems in ways that they don't want to be questioned. They want you to talk about diversity and inclusion. They don't want you to talk about abolition and the dismantling of these systems. So I don't say there's even such a thing as a decolonial method. It doesn't exist. So yeah, all we can start to do is, you know, be with each other, ask these questions, and come into relation. But the way even we think about change in development studies and possibly in global health is that the change will happen like that or within one generation. And this is where we need to learn from non-Western ways of knowing and being in the world, because it takes generations. And the work and the things that you do now might only come to fruition in 20 years, 30 years, 50 years. You don't know, but you do the work. So, yeah.
Thank you, Zuleika. Yeah, and maybe in connection to this, I've received a question from our global health research class, so the students that are in the room together, and they ask, how do you, as a student from the South studying in the North, hold space for peers and new material around race without doing the emotional labor, especially if there is pushback and your perspective is in the minority?
Is that directed to anyone in particular?
It's not.
I'll try and be very brief because I feel like I'm talking too much. But one of the things that I do have some power, and I often like to say that very, very clearly. I edit one of the most important journals in global health, and that is power. And in many ways, that has, I suspect, protected me from the worst of the consequences of the things that I say and write. Because I have some power, people, I think, are a bit more careful about attacking me, which is nice. But what I then do with that privilege is to hopefully say the kinds of things that people can then feel like they have the permission and the license to say things that they otherwise would have been afraid to say. Because, you know, he said it, he says it every day, so it's easier to say. Or even if you're afraid of even saying it yourself, you can just quote what he said. I mean, he said that, what do you have to say in response to it? And, you know, I do my work with that consciousness. I wish people with bigger power than me would do more of that if they are convinced. Because I feel that lots of people, as Zuleika was saying, who are deeply, for good reason, are afraid and ought to be careful about what they say. But the more people with some platform and some power say these things, I believe the easier it is for more people to say it, and the easier it is to build that critical mass that I think we really need for big change to happen.
Thank you, Seye. Oh, Zuleika, do you want to add?
Yeah, but I haven't formulated the thought properly in my head because I want to also build upon what Seye is saying, right? So often people ask me, or people get very defensive sometimes when I present the kind of ideas, limonography, for example. But then one of the questions is, then what do you do with Western epistemology or the modern colonial knowledge system, right? And for me, it's not a dismissing of it, but it's a humbling of it. It's a one knowledge system amongst numerous multitudes of other ones, right? And importantly, the reason why we don't dismiss Western or the modern colonial knowledge system is because there's key anti-colonial work that has been done within that. The work of Frantz Fanon, for example, right? And so if we're going to disregard it, then we're going to disregard all of that. And that's not the point. The point is that we use the ideas of Fanon, we use the ideas of key anti-colonial thinkers, but we don't also take on the limitations upon which that work was written, because they were writing within an incredibly hostile academic environment and saying things that could have actually got them killed. So it is sort of, you know, and maybe I told you the thought wasn't fully formed. So I want to try and connect that actually to the way in which I teach. And how do you teach this to students? You know, and what I struggle with a lot is particularly how absent the conversations about mental health are within academia. Students have just survived a pandemic, right? There are high levels of anxiety and stress, and there are still people getting sick. I mean, I felt guilty because I got COVID and I had to take time off, and it derailed my entire course because the course I was teaching just started, right? And so having these difficult conversations with students for me is always through I use intersectionality a lot, But intersectionality, not in the ways in which we talk about, oh, these are where my identities intersect, and this is my positionality. And in South Africa, what we call the Olympics of suffering, who suffers more, right? But for me, it's about speaking about proximity to power. Everybody has a certain proximity to power, particularly within academia. The mere fact that you're in here already puts you closer to power. And it's what you do with that. Right? And so the example I always use is English. We are writing, speaking, communicating, producing knowledge in English. And that already puts us closer to people who, let's say, don't speak English at all, or English is their second, third, fourth, fifth language. What are you going to do with that? And it is to use your voice and to speak up for social justice, not in terms of being an ally, which Esther mentioned, because ally already marks a separation between you and the other person. But it's starting to acknowledge that your freedom is intimately connected with the other. And if the other isn't free, you aren't free either. Yeah.
Thank you, Zuleika. And with that, I think I'm looking at the time. We have, I think, 1 minute left in our meeting. So thank you very much for this roundtable discussion, your insights, sharing. I hope for all of those in the meeting, this was helpful. This was a learning opportunity. I hope this sparks reflection amongst us as researchers, us as students, and among our peers. So thank you very much for this discussion. I want to close today's webinar. I'm sorry that I received many more questions. I hope we can take those questions to our discussions in continuation of this within APH, but also within our own research institutes. So with that, thank you very much. Thank you, Ike. Thank you, Zuleika. Thank you, Esther. And thank you, Seye, for your time and for being with us here today. And for the rest in the webinar, we wish you a very wonderful rest of your day or evening. And hope to speak soon again about this and having this conversation.